Another question from a patient: since my diagnosis and bone marrow transplant, my teeth have been deteriorating. Is there a connection between dental health and myeloma?
Very important question, because although this is not a very common finding, it is something that really affects quality of life. So myeloma itself does not always or frequently cause teeth problem or dentition problems. But you can imagine, teeth are bones. Myeloma can affect bones. Myeloma affects calcium deposition in bones. So teeth can get damaged in 2 or 3 different ways in myeloma patients. First, if myeloma involves the jawbone, you can imagine that the teeth in that particular area could become loose, or they could become a little off because the structure is getting affected. Sometimes if myeloma is present in the jaw, for example, and radiation is given, well, that bone becomes weaker, so teeth can become weaker. Another way myeloma and teeth dental health can be connected is because we use certain bone strengthening agents for myeloma. These drugs are called either bisphosphonates, for example, zoledronic acid or amidronic acid, what patients may know as Zometa or Aridia. Or there's a second category called rank ligand inhibitors. One of the drugs there is denosumab or Xgeva. These are all drugs that are given for bone strengthening for myeloma. Patients are recommended to take calcium and vitamin D, but a rare but definitive side effect that is known to happen or can happen with these drugs is what's called osteonecrosis of the jaw, where basically the jawbone is becoming necrosed or less viable. And you can imagine, if the jaw is less viable, the teeth that go into the jaw in that spot, they'll become loose and hurt, painful. It's not a good condition to have. It affects quality of life significantly. So while it is rare, this osteonecrosis of the jaw can occur maybe in less than 10% of the cases, but it is a significant morbidity causing issue. What I recommend to patients is that, one, if that is happening, first of all, we typically don't continue that drug that is causing it, like a bisphosphonate or rank ligand inhibitor. Secondly, the patient needs to see a good oral maxillofacial surgeon or a good dentist, preferably someone who has knowledge and experience in handling osteonecrosis of the jaw. So different ways in which myeloma or its treatment can affect the jaw. There is not a direct correlation, but in about 10 to 15% of cases, there may be jaw or teeth-related implications in myeloma patients, either from the disease or its treatment like radiation or bone strengthening drugs.